So here we will start a new topic, introduction to the respiratory system. So what is the normal function of the respiratory system? I think you all know about the normal function of the respiratory system, which is the exchange of the gases, which is the most important function through which we are alive, we are here. And then we are also able to know about the non-respiratory function of the respiratory system, which is the defense mechanism, olfaction, pH balance, olfaction, everyone knows about the olfactions, smell sensations, and pH balance, that is the acid-base balance. If H plus increase, then it leads to the this acidosis. If H plus decrease, it leads to the alkalosis. Maintaining of the water balance, then thermoregulation. And then we'll come to this defense mechanism. How respiratory system play a main role in the defense mechanism. First, nose containing the hair, which will trap the dust particles. Bigger size dust particles, it will trap the dust particles. If this dust particle is smaller in size and if it will not trap in the nose, then it will go inside. But in the respiratory system, it is the trachea which is lined by the pseudostratified ciliated columnar epithelium. Because of the mucociliary action of the cilia, it will throw the dust particles upwards towards the pharynx and then it will come out through the cough reflex.
ठीक है स्टार्ट कर.
As we know, the respiratory system is lined by the mucous membrane, and the mucous membrane contains the goblet cell which secrete the mucus and it will trap the dust particles. And then again, there is the alveolar macrophages, which is a type of the tissue macrophages. It will phagocyte the dust particles. So first we will start from the nose and then again we will go to the alveoli, and overall there is a defense mechanism as we have seen. Okay, so first it will start from the nose, then it will go to the pharynx. Pharynx is having three parts. First is the nasopharynx, second is the oropharynx, and third one is the laryngopharynx, and then larynx, then trachea. Then trachea will divide into the two primary principal bronchi. Draw a diagram so that it will be more clear. So it's a nose, trachea, two primary principal bronchi, and then it's a left lung, it's a right one. And after entering into the lungs, it will divide into the secondary, after entering into the lungs, it will divide into the secondary bronchi and then tertiary bronchi, and then it will again divide up to the bronchioles, and it
स्टार्ट कर.
bronchioles having a diameter of 1 mm or less. Then again we'll go to the respiratory bronchioles, and it is having a diameter of 0.5 mm or less. So again there will be the alveolar duct. First there will be the respiratory bronchioles of 0.5 mm, and then from the respiratory bronchioles there will be the alveolar duct which will come like this, and zoom it. Alveolar duct will open into the alveolar sac, and it contains millions of the alveoli like this, and the space which is present inside the alveolar sac is known as antrum. And then alveoli is made up of the two types of the cells. Like two types of the layers will be there. First is the squamous epithelium layer, and the second layer will be the cuboid. So here is the diagram, and second layer is 5% present in the alveoli, and it will secrete the surfactant which will decrease the surface tension and prevent the lungs from the collapsing. So this is the surfactant layer, and then this is the alveolar fluid layer. An alveolar fluid layer will increase the surface tension. It is responsible for the lung collapse. So it is a squamous epithelial layer, which is the pneumocytes type 1 layer. So which the exchange of the gases will take place, and it will present 95% in the alveolus. Okay, so here is the basement membrane of the capillary endothelium. It is a capillary endothelium. And there is a phenomenon known as a ventilation and the perfusion. So what is ventilation? The air which is coming inside the lungs and going outside the lungs during the respiration, process of the respiration is known as ventilation. And then perfusion. The amount of the blood present in the capillary for the purpose of the gases exchanges or the diffusion of the gases, like gases exchanges at the level of the capillary, is known as a perfusion. Ventilation perfusion ratio should always be maintained. It might be approx 5:8. Now we'll go to the classification. So upper respiratory tract, lower respiratory tract, from the nose to larynx, it is the upper respiratory tract, and then trachea to alveoli is the lower respiratory tract. System, that is the conducting zone and the respiratory zone. So from the respiratory bronchioles to the alveolus is the respiratory zone, and the remaining is the conducting zone. And respiratory zone is also known as the respiratory units. From which the gases exchange will take place, and the remaining one is having the tight endothelium. So there will be no leakage. Then again, we'll go to the intrapleural pressure, which is normally negative in the pleural cavity, which is present in the parietal and the visceral pleura. Why it is negative? So because of the pumping out action of the visceral fluid which is present in the pleural cavity, that leads to the always pumping out action, that leads to the negative intrapleural pressure. Okay, then again, what is the significance of the negative intrapleural pressure? So first is the importance of the negative intrapleural pressure is the prevent the collapsing of the lungs. And second is the venous rhythm. Then intrapulmonary pressure. So normally it is equal to the atmospheric pressure, that is the 760 mm of the Hg, and during the respiration, during the inspiration, it becomes negative, so that pressure will decrease and more amount of air will come inside, and during the expiration it will become positive, so that the air will come outside. And we'll again go to the rate of the respiration. Any guesses towards the rate of the respiration? So it is 12 to 16 rates per minute. But due to tachypnea, it will be above 22 beats per minute. But bradypnea, less than 8 beats per minute. Rate per minute. So when tachypnea will going to be happen? Increase in the rate of the breathing. When it will be going to be happen? Like if we want to, we are in the hypoxic condition, like less amount of the oxygen is available. So we want oxygen. So more demand of the oxygen leads to the tachypnea. Increase in the rate of breathing. And age. And then when again will come to the orthopnea and tachypnea. They are like opposite to each other. So what is orthopnea? Difficulty in the breathing while lying down during the night or lying down in posture, and but relief while in the standing position or the sitting position. Why? Because of the accumulation of the fluid. Like we will see one example, then you will understand. So this is the body. So fluid is inside think it is a lung, fluid is inside, it's a respiratory system, and when it will lie down, water will accumulate over all the surface of the respiratory system. So it will distress. There will be the aggravation of the respiratory system. But it will be in a standing position or sitting position, it will come to a particular site towards a like small site, and then rest of the area got relief and the patient got relief of the breathing. Like there will be amelioration of the breathing. And then platipnea. So what is platipnea? The platipnea is the same example of the bottle. As air is filled, like during the hypoxic condition or blood volume will decreases, hemoglobin will decreases, so the oxygen level in the body will also decreases. So that in the respiratory system. So what will happen here? First, let us assume that oxygen is the water fluid in the bottle, and this bottle is the respiratory system. So what will happen if it will lie down? Then oxygen will spread into the overall the respiratory system. So the patient gets relief while lying down posture, but during the standing or sitting posture, it is aggravated because oxygen is not fulfilled towards the all surface area. It is present towards a particular area of the respiratory system. Then we'll go with the apnea. What is apnea? Or say what is eupnea? So eupnea is a normal rate, but apnea, it is a temporary arrest of the breathing. If eupnea happens like before the 2 years of the child, then it is physiological. But if you have apnea, and if apnea happens above the 2 years, that is pathological. And hyperapnea, increase in the rate and the depth of the breathing. So hyperapnea is increase in the depth of the breathing, not rate. So why we need to increase the depth of the breathing? So what will happen in this case is like we want to we want to expire CO2, excess amount of CO2 from our body. That's why it leads to the increase in the depth of the breathing. Removal of the excess amount of CO2 from the body, lungs, basically. And in Kussmaul's breathing, which is also seen in diabetic patients, like severe stages of diabetic patients, there is also increase in the rate and depth of the breathing, which is known as Kussmaul's breathing. So that is the case, and now I hope everything is clear. Thank you.